So far, we've been talking about all different assessments in the dental hygiene process of care. We've talked about medical history, dental charting, perio charting, assessing for deposit, biofilm, all those things. Now we're up to the diagnosis phase in the dental hygiene process of care. So we finally made a big shift. And basically, the diagnosis is pulling all those assessments together, finalizing in your mind, and that's going to drive your treatment plan, which we'll do next, which will drive your implementation, which you will evaluate your patient's success. And the documentation phase is basically integrated throughout the dental hygiene process of care, and we're always documenting at every step of the way. So the general definition of a diagnosis, it's an analysis of the cause and nature of a problem, condition, or situation. So it's a very generic term and can be applied in any field, really, and you're probably more familiar with it in the medical community. So we use the same thing within dentistry. For example, there are different kinds of diagnosing that dental hygienists do versus a dentist. So basically, a dental diagnosis, that's a diagnosis that a dentist would do, is basically identifying a disease or a condition which the dentist directs or provides the primary treatment of. So an example of a dental diagnosis might be decay on number 14. It might be vertical bone loss on 14 distal. It might be periodontitis, generalized periodontitis. It might be a perio abscess on number 3. Those are all examples of a dental diagnosis that a dentist is licensed to treat. So those are things that, for example, decay is not something that the dental hygienist is licensed to treat. So we use the word preliminary diagnosis, and that's a term that we use for diagnosing patients, but we know the conditions that we're not licensed to treat needs to be confirmed by a dentist. So that's why we use the word preliminary diagnosis. It will need to be confirmed from the dentist. Now, there are many things which the dental hygiene clinician is licensed to treat. And then we use the word dental hygiene diagnosis. So if it's in our realm of practice, and we need a diagnostic statement, we call it a dental hygiene diagnosis. If it's a dental condition that the dentist is licensed to treat, we call it a preliminary diagnosis if it's made by the hygienist. If a dentist is confirming a diagnosis, it's just called a diagnosis or a dental diagnosis. So Wilkins defines a dental hygiene diagnosis as identifies those patients' needs for which the RDH will provide interventions. So very similar, focusing on what the hygienist is licensed to treat. So some examples of a dental hygiene diagnostic statement are a little longer, more complicated statement as opposed to the dental diagnosis that I gave you, for example, was caries on number 14, something like that. So a dental hygiene diagnostic statement would read, you include the problem and you include the term related, and then you put the cause. So some examples might be hypersensitivity related to exposed cementum or gingival recession, gingival bleeding related to biofilm accumulation, increasing probe depths related to uncontrolled diabetic condition, things like that. So you're always focusing on the primary problem and what you think the cause is. And for every patient, you could do many, many different statements depending on how complicated the patient is. So you want to think about creating one dental hygiene diagnostic statement for each patient, and you're going to try and find what the priority is for that patient and you as the clinician. You know, if a patient has decay, and it's rampant on so many teeth, you're not going to focus on something small, like maybe toothbrush abrasion on a few sites. You want to focus on the biggest problem for your patient. And hopefully you and your patient are in alignment on what the biggest problems are. So components of the diagnosis, it includes a short, concise, two-part statement, the problem and the etiology. It's a statement of a conclusion resulting from identifying a pattern or relationship between the signs and the symptoms. So this diagnostic statement is basically after you've already done hours of assessment and looking at everything. And then it's basically the, what does that mean? And pulling it all together. It's the stop and thinking component and thinking about all your findings. So you want to reference your condition. You want to make sure that you're staying in your dental hygiene diagnosis is staying in the realm of dental hygiene. And you always want to validate your diagnostic statement and your diagnosis whenever possible. And it's the two major components are the processing, the classification, the interpretation, and the validating of your diagnosis and coming up with your diagnostic statement. So the process, again, you're going to use all that data that you collected in the assessment phase. It's the stop and think moment where you're using all your critical skills. You're trying to find patterns or relationships. You might have seen something you weren't originally sure what it is. Now you're trying to pull it all together. Maybe things can be more complicated than you realized. So you're trying to pull all your assessments together. And then you need to kind of organize and think about all your assessments. What are all the issues that the patient presented? What do you need to address in the treatment for the patient? And sometimes your assessments can take hours, and sometimes it'll be stretched out over multiple appointments. So this stop and think phase is very important because you may forget all those little details. So it's bringing to the forefront what are the most biggest issues we need to think about for the patient. So we're always focusing on the patient and their individual needs. And we're always trying to focus on things that we can prevent or minimize or help resolve for the patient. And that is what's driving the treatment plan or care plan. So here are some more examples of our diagnostic statements. So high periodontitis risk, or it could be a patient that has periodontitis and they're past the risk stage related to inadequate oral self-care. High caries risk related to a high sucrose diet, caries related to high levels of streptococci mutans, abrasion related to aggressive toothbrushing. So here are a few examples that your patient might present with. So what do? We're going to use the dental hygiene diagnosis portion of our treatment plan form. And this is what it looks like. And at the top part of this form, you are going to want to circle all the issues that present for your patient. So you're going to look at all the conditions at the top and just circle all that apply to your patient. And then you're going to make a dental hygiene diagnosis. So you're going to think about all the conditions that your patient presented with. Then you think about, okay, what's the most important issue that we need to address for the patient? And then you're going to, in this white box, you're going to include your dental hygiene diagnosis. So this is where you would put caries, risk related to inadequate self-care, something like that. And then that should drive the rest of your treatment plan. So if caries are an issue, then I should see a treatment plan that is reflecting that with preventative strategies for the patient. So basically, that's a dental hygiene diagnosis, and it will take lots of practice, and soon you will be very comfortable with that.